Hi, everyone. Thank you so much for joining another live stream from Epicenter NYC. We are a newsletter launched in July of 2020 to help New Yorkers get through the pandemic. We have evolved into so much more than a newsletter. And tonight we have a really special edition of our live stream. We're partnering with Scrollstack. Scrollstack is a platform that I describe lovingly as a better version of Twitter meeting Medium. It's really a creator network, both Epicenter, and it's very global in its scope, global, cultural, literary, audio, video, text. And so I share that because Epicenter and Scrollstack are together members of the URL Media Network, a network of Black and Brown media outlets that I also co-founded back in January. And I think most of you tuning in might know about Epicenter's efforts around vaccine bookings. We have been helping New Yorkers secure appointments for vaccines since January. We began with the elderly, moved on to restaurant workers, folks who had different health ailments and comorbidities. And of course, now New York is in a state of everybody above the age of 16 being eligible. And we are helping folks navigate. We've kind of shifted from booking into much more of outreach. But in recent weeks, it's become impossible for us to separate the rest of the world from our efforts here in New York City. We are a local operation, a community-driven operation, but our definition of community is quite expansive. And that's for a few reasons. We're named the Epicenter. We're based here in Queens, Jackson Heights, Corona, and Elmhurst. We're dubbed the epicenter of the epicenter. The same conditions that make us love this neighborhood. It is global, it's dense. You can do your shopping here within a few blocks of your home, get your laundry done, get something to eat. But really the comings and goings of this being a global neighborhood are the same factors that made it a real breeding ground for COVID. I think it's also worth noting that our families are not bordered. We live in certain zip codes. We might work in other zip codes, but many of us are on WhatsApp or text message with our families in either another country or multiple countries around the world all day long. That is very much what defines this neighborhood and certainly defines the borough of Queens. And then the last thing I'll mention is that for the last 6 weeks or so, Epicenter has been receiving many emails, many DMs on Twitter, as well as phone calls and requests for people overseas to try to get their vaccines in the US. And so what just initially felt like, a few exceptions has become much more normal for people to be requesting this. And I just wrote a piece in Epicenter yesterday, borrowing some language from Kenyan officials who say we are in the middle of a vaccine apartheid. I don't think that's hyperbolic, and our guest tonight will take us through what the rest of the world looks like. I did want to bring on Elena Tate, who is one of our head volunteers, a partner in so much of making this possible. These efforts from Epicenter, we've been able to help get vaccine appointments for more than 5,000 individuals. So Elena, thank you for being here again. You've been vital to this operation and you've been a real key partner on these live streams.
Thank you, Mitra.
Of course. And I did promise to get you out of here by 9:15 so you could put your son to bed. So I'm going to stick to that. I'm just wondering if you, who's been talking to more folks in need of vaccines, just want to kind of give us what's New York looking like right now, and then we can kind of pivot to the global piece of it.
Well, I think New York is looking okay. But I do see people who are worried about their families around the world. As you said, our families are not bordered. And I think it's interesting that the virus has kind of understood that humanity is one family, and yet people still don't realize that. And we have so many divisions and lacks of access to the vaccine and medication and oxygen depending on, where you happen to be born.
So tell me about, I'll throw in some of the color as well. But the ones that I've directly gotten, I got a man in Germany who said, "I can fly to New York this week. Can you get me an appointment?" My wife and I. He sort of asked what the process is to go. What do I need to show? How could this work? I'm just wondering if that anecdote sounds familiar to you.
Yeah, we see people, say they have dual citizenship, they have a 10-year visa, they have the means to buy a ticket, and they will get vaccinated some way, somehow. And then there are the 90% of people in the country, whether it's in Latin America or Africa, who can't travel and can't get the vaccine, and doctors and nurses and elderly people who are just kind of stuck and waiting for either, a donation of a vaccine or the ability to create a generic vaccine that is more accessible. So we definitely see, a discrepancy in people who are able to come to a country that has plenty of vaccines. Here in New York now, the appointments aren't even getting filled up anymore. So we definitely have a lot of vaccines here.
Yeah, I think that's been one of the challenges in some ways because, of course, we're a global city. So many of us either have friends overseas or family. And so we're caught between, at least at Epicenter, and Elena, you're getting these same emails from doctors, pharmacies, vaccine sites saying, "We have extra doses, please send us your people." Like, we'll get these panicked emails, right? I mean, you correct me if I'm wrong, or
Yeah,
kind of
people, pharmacists, they've opened the vial and they say, "We're going to throw away 10 doses unless you get them in here before 5 o'clock."
Yeah.
And then we're scrambling to try to, now we've actually gone back into our database to contact people who have been vaccinated that we helped, maybe 2 months ago, and asking them if they have any friends or family that we can help them get vaccinated, because we're kind of twiddling our thumbs as expert bookers, and then there are all these appointments and walk-ins, and really no one really needs us right now. But there's still all of these people who are not vaccinated around the world. So this is kind of the issue.
Yeah. So you sent me, I'm going to put you on the spot. You sent me a note about, I think, 4 weeks ago saying, should Epicenter take on vaccine equity across the world? And my response was, well, we're helping immigrants in Queens. I feel like we're doing a lot for I was kind of dismissive. I'm going to publicly admit that I was somewhat dismissive. I just wonder if you can, I don't know if you remember that email exchange. Do you remember that by any chance?
I do.
Oh, you do? Okay. So what prompted you to send me that note? Because it was before we had the situation in India. It was before, I mean, I don't want to say before. Maybe India was starting to turn, but I didn't know it, right? It was before I saw this in the media a lot. So what was it that kind of prompted you to send me that note?
Well, I've been following this situation since the vaccines were approved in this country back in December. And specifically, I remember seeing like the vice president of Costa Rica sharing pictures from the airport at like midnight when a plane arrived with a shipment, and people crying, and just around the world, it's so different. There are countries that have received maybe 2,000 vaccines, or have vaccinated less than 1% of their population in Central America, Africa, and it's just kind of a situation where people from the United States may be vaccinated and then going on vacation to countries where no one can even get vaccinated. So, and we don't know if you can transmit it once you're vaccinated, hopefully not, but it's just a real issue of equity and access.
Yeah. Before I let you go, what else is on your mind that you wish people knew? Because you have this uncanny ability to kind of predict where things are going to twist and turn. So I this time I'm going to listen. So tell us what you're seeing and hearing on the ground.
Well, one thing just that I do not want to repeat, I don't want history to repeat itself in terms of smallpox. So I saw a statistic that North America beat smallpox 20 years before Africa, Asia, and South America. And India recorded a few million cases of this lethal pox after cases had already disappeared in the United States. So I think we really need to think about ourselves as a global entity, humanity. You know, we travel, the virus will come and go. We can't pin it down where it came from or where it's mutating or whatever. We really just need to try to get everyone vaccinated so that the virus doesn't have any more ability to mutate and spread and infect and, of course, devastate more countries and more families.
Thank you, Elena. I think you can get back to your son and put him to bed. Please wish him good night from all of us. And thank you.
I wish I could stay. It looks like we have a great lineup tonight.
We're really lucky. We're really, I mean, I feel like in some ways this conversation, I feel like we probably should have been having versions of this over the last year. And I do feel this great regret that I was.
Don't be so hard on yourself.
Well, I just had this like tunnel vision over my people in Queens. And then, as we'll talk about, when it came from my family, I suddenly thought, oh, this is the whole world's family. Like, this is the way that we, as you articulated, are quite united. So we're going to let you go. I do, and thank you so much for being with us, and good night to your son, and lots of love to him. So we're going to pivot to our main guest tonight. I actually called them neighbors. There are neighbors from around the world. But before we do that, I just want to remind everybody that we are taking questions in the chats wherever you're watching this, in the comments. You can reply on Twitter, you could leave a comment on YouTube, wherever you're watching this, just leave your questions in the chat, and we have folks who are monitoring that and can alert us to your questions. And in some cases, if we can't answer them among who we have assembled here, we will try to get you the answers, and chances are Epicenter or Scroll Stack has written about what you're asking. So we'll go and dig out some answers. So tonight we have some guests on to dissect how we got to this system of vaccine apartheid, how we got here, and what's needed now. And our first guest is Rohan Venkat, who is a reporter with Scroll in India. Hi, Rohan, how are you?
Hi, Mitra. Good, how are you?
I'm okay. And we have André Fran joining us from Brazil, and Valerie Vasquez de Velazco, who is a journalist in Peru, but is actually joining us from Miami, where she is on vacation, I believe, with her family. Is it vacation? You're seeing family in Miami? Yeah.
Vacation and vaccine, no?
Yeah.
Vaccine tourism.
So we'll get into what brings you to Miami later, but she's usually on television in Lima. So Rohan, I guess I want to start with you to just give us a sense of what's the status of COVID in India. We've all been seeing some really alarming and disturbing reports. We've had a few record days in terms of cases. Can you just catch us up on how India is looking right now?
Honestly, things are still very dire. We've had 6 days in a row with more than 300,000 cases and over 2,500 deaths per day. The models that we're looking at suggest we could be peaking at 500,000 cases a day. Some are even projecting up to 1 million cases a day, which is terribly scary, considering that a lot of healthcare systems have fallen apart, even at this level. I think what may be particularly relevant, and these are some of the things our team at Scroll, a small independent news organization, my colleagues have been covering, is that Delhi, for example, has had 3 waves before this. And there was the general sense that we had hit a certain level of immunity within the city, even without vaccines, that we had weathered the storm. Things had gotten down to fewer than 1,000 cases a week in January, February, and then we were just hit by this complete wallop of cases in late March, early April. Where today you have people running around. Hospitals are completely overburdened. The government systems have fallen apart. So trying to find a bed, trying to find medicines, trying to find oxygen is entirely up to the patient or their family. So people are just running around trying to get the basics of care. People are dying not because of the virus, but because of the lack of healthcare facilities, the lack of supplies. My timeline last week, 7 out of 10 things on it was people requesting help, asking for resources, medical or medicines or oxygen. Today, 3 out of those 10 are now death notices. It's really horrific here.
Wow. Huh. And Rohan, you are in New Delhi?
I'm in Delhi, that's right.
You're in Delhi. Okay. So the Biden administration on Sunday made a fairly major announcement saying that they will extend resources. They mentioned ingredients for some of the vaccines. They mentioned ventilators. They mentioned medical expertise. There was a few other things. I mean, feel free to summarize that announcement. I just wonder how that's being received in India.
Over the last week, I mean, for a while, India felt like it had dealt with the virus pretty well, especially through January, February. There was some rather self-congratulatory work from the government, which with the ruling party passing, for example, resolutions commending India for doing great. But over the last week, it's properly exploded in such a way that India has had to turn to the world for help. The Biden administration was rather uncharacteristically, for some folks, late in offering help. I mean, we had the Pakistani government, the Saudi government, the Russians offering ventilators and oxygen much before the US did. And there was a lot of commentary because there is a large Indian American population. There's a lot of scholars and folks in the policy space invested in this relationship. And over the last 3-4 days, the Biden administration has turned up in a big way. One of our biggest, the biggest vaccine manufacturer in the world, the Serum Institute of India, has been complaining for some time now that they have not been getting supplies from the US to make vaccines. It's been unclear whether this is for a vaccine that's currently being put out or one that will come later in the year. But the Biden administration turned up this week, said that it would not only move supplies to India that were being held up and offer expertise, oxygen, ventilators, and even doctors, but that also the existing supplies of AstraZeneca vaccines that the US is not planning to use, that it will open up for international usage. We don't know yet whether those are coming to India or to other developing countries, but it's certainly being seen as a belated action from the US, which had been going closer to the Indian government, particularly because of China over the last year and a half. But it's turned up in a big way, at least over the last few days.
Well, thank you, Rohan. So, André, does this sound familiar? The scene that he's painting, it's dire, it's grim, but is that, Brazil has, I believe, the second highest death toll globally from COVID. Is the picture that Rohan's painting, does it sound familiar? Oh, I think you're muted.
Yes, okay. In advance, pardon my English, I was talking to Mitra and everybody else. I'm a journalist specialized in international journalism. I traveled the world speaking in English, but since the pandemic, I'm stuck at home for more than a year, just talking in Portuguese with my family. It is one of the consequences of all this. And when I mean all this, I'm talking about the fact that in this wave of extreme rights representatives that took over the world, and we saw Trump and Boris Johnson, Matteo Salvini in Italy, and Orban in Hungary. We have Poland. we got stuck with probably the worst one of all, which is Jair Bolsonaro, the president of Brazil. It's the most extremist and the most science denier in the middle of a pandemic. We are now over 14 million deaths, and we are approaching 14 million cases and 400,000 deaths in Brazil. And it's in great part due to the lack of efficiency in our government. Our president for a long time was against vaccination. He almost today still gathers in public. He refuses to wear a mask. And this goes on and passes through to society as a whole. Just today, actually, there was the start of a Congress investigation to investigate how the government dealt and is dealing with this pandemic, because there was many mistakes. We refused more than 11 offers from vaccine producers from different parts of the world, and just like recently, he started a little bit taking the right measures, at least talking about it, because we have our former president Lula, who was jailed while on campaign against him the last elections. In the middle of the campaign, he was put in prison, and a few weeks ago he was released. A few months ago, a few weeks ago, his judge and the whole system that put him in jail was considered flawed, and he's the major adversary for Bolsonaro. So he started to take things more serious and more science driven. But it's too late. We're almost having like more than 3,000 deaths a day, and the small vaccination progress that we have is due to the governors acting independently.
So that's local governments?
Local government from the states acting against Bolsonaro and his government directions, and negotiating and bringing vaccines to Brazil. That's how we're getting. When we look at it right now, we have like 12% of the population vaccinated. Most of this is not from the government; it's from local state governors doing their part. And it's a really difficult situation that we are just now starting to see the light at the end of the tunnel.
Yeah, so much of what you're saying is so resonant. I could also see Rohan nodding to some of it in terms of science and leadership. But I'm really thinking about kind of how the local governments and kind of it becomes like each man for himself in the scenario like this. And it's certainly on the ground in New York City, it's been very confusing, but again, the blessing is that we have access to the vaccines. It's the administering of them and the booking of them that's very confusing. I'm just wondering if we can turn over to Valerie, who is usually in Peru. Is this sounding familiar? Can you tell us what the on-the-ground situation in Peru is in regards to COVID?
Yes. Hello, everybody. Hello, Mitra, André, and Rohan. Yes, I just came yesterday. I arrived to Miami this morning at 5 a.m. and it was because for people that have my age, 44, I have the vaccines in my country will be I don't know when, maybe December, maybe not this year. So this possibility to come here to travel and to try the vaccine was something that a lot of people was trying. There were states that were open, so yeah, we're following those news constantly. So we just tried that story. And then we arrived, and it was so fast and it was so easy. And it's a little bit of what you were telling, that vaccines are here, and it's easy for any person with a Peruvian document or any document to just have this passport for health. But it's not the same story in our country, no? My family, we just had one aunt that got the COVID with 81 years, and we initiate the vaccination process on February, but then it was for doctors and the first battle line, and it was working in some way, but finally, just 2 weeks ago or 3 weeks ago, we began vaccinating to the oldest people. And well, in this case, my aunt, she passed away 2 weeks with this COVID because somebody entered her home just for helping her. So she didn't have the possibility now, no, and that happened in a group of people that have more possibilities than the rest of the country. I live in the capital. I have I'm very lucky in my country. I'm maybe the 5% of people that have the possibility to get into a hospital if I got an emergency or something. But now, and with these variantes, we are just having the COVID really, really near to us.
Yeah.
So, yeah, and the thing is that we have this healthcare system that was bad in every way, but now it's like it's completely collapsed. We have 33 million people, not 1,300 million people, but I don't know exactly how it counts, but we have 400 people dying a day. In the last week, we have the second wave of COVID now, and at the same time, we have these politic problems like André tell in his country. So we have a little bit of every part and every story that you were telling.
Yeah.
That's what we get now, and this is the second wave, maybe just the second wave.
I'm so sorry about your aunt. I'm really sorry to hear that. My aunt also passed away of COVID last year in India, and I'm really sorry to hear that. When did she pass?
No, that was yesterday. The problem is,
okay.
Yeah, it was yesterday. She got sick like 2 weeks ago, but the problem is that she had the possibility to have some help instead of the other people, and in that way, even having 81 years, and she's in the group of people that should have the vaccine already, that didn't happen. And that's the thing. It's like everything it's happening like in days, in hours, and our systems, our countries are not they don't have a good reaction for sure.
I do want to mention that if anyone has questions, they should post them in comments. We have someone monitoring them, and I'm happy to pose them to our guests, Valerie, André, and Rohan. Can I ask, Rohan, how are you reporting this? Because we see the scenes, crematoriums, we're seeing like literal bodies outside the hospital. Are you encountering that? Like, tell me what your reporting process here has been like.
Yeah, Mitra. So I myself mostly edit and do analytical work. My colleagues have been on the ground reporting from across India. We're a very small team, but they've been managing to do some work. We have tried to keep our reporters away from too much immediate interaction until they're eligible for the vaccination. Starting May 1st, all adults over the age of 18 will be eligible for vaccinations in India. but they've still had to do some of the work on the ground. We're a relatively smaller organization, but there have been hundreds of incredible journalists around India turning up outside hospitals, speaking to people about their difficulties, showing up at crematoriums, just understanding what's going on, because the story is vast. And while Delhi gets covered a lot and has been covered a lot over the last week, the story goes right into the interiors. Compared to the first wave, which peaked in about September 2020, and which was honestly nothing compared to what we're seeing today, the numbers are going far into rural India, into villages, into places where there's no testing, there's no hospitals, there's no availability of oxygen. And we still have journalists going out there encountering this at their own risk. We've had a number of, I can tell you, of the last 2 weeks, a lot of journalists have died as well as a result of this wave. Some of them not even able to secure hospital beds for themselves. So it is, for a while, we've been demanding a frontline status to journalists, which was not given in the first few phases of the vaccinations. But starting May 1st, hopefully, reporters on the ground will be able to be vaccinated.
I hope so. I think what you're saying about coverage is really interesting with India, because I think you know this, Rohan, but the audience won't. I'm from the state of Assam in the northeast of India, and over the last week or so, people were saying, "Oh, it's not as bad in Assam as Delhi, Bombay, Bangalore," and we kept hearing it's not as bad. And then yesterday felt like, you know, how I was talking about that turn, right? When things turn, and I got two things happened within like minutes of each other. One is the chief minister of Assam, like kind of the governor system that Andre's talking about, is imposing a curfew, I believe, so that people have to stay indoors, because there was still a lot of movement, and they're starting to see another surge. And then I got within minutes of that, I got a text message from my mother with a list of people who either have COVID in our family or their family. And then there was a man who cared for my grandfather, whose father just passed of COVID, and he's in the village. So he's not in Delhi, Bangalore, or Bombay. And I just had this feeling of, we know how COVID spreads, right? We've gone through this over the last year over and over, where we say it's only over there. And then we kind of, you know, I mean, you've seen the behaviors, and I just had this kind of, this awful feeling like, oh no, now it's in my text messages, right? And it's very selfish for me to say that, because that's not, of course, that's not to diminish people who've been going through it, but when it's your own family, it feels suddenly very different. So, André, I'm just wondering how that resonates with you. Like, do you have, you know, are family members kind of doing the same, communicating with each other? How does that play out on the ground? Oh, I think you're muted again.
Okay, I'm getting the hang of it now.
That's okay. Don't worry. We'll take it.
An hour or two, I'll be all right. But we've been dealing with this for more than a year now, and we have different stages. But right now, after like the first and second and like third wave that mixed together with one another, because we didn't even have like a low point of cases and deaths of COVID here in Brazil. But right now, I can say that everyone has someone in their family which either died or had COVID, or someone who was hospitalized. My mother got COVID. Fortunately, she didn't need to go to the hospital, because in many cases there is no place, there is no beds, and there's no vacancy in hospitals here in Brazil. And I'm talking about in Rio de Janeiro, which is one of the more privileged states in the country. And it happened like it's really common that people have to stay in line so they can go to a room or to receive help in a hospital. And if you think that this happens because Brazil infrastructure is bad and we are a developing country and poor, and which is also true, but if you remember, in the H1N1 surge in like 2008, 2009, we vaccinated 80 million people in 3 months. So if there's one thing that really works in Brazil, and that our country is like was an example to the whole world, is our capacity to mobilize and the capacity of our public health system to spread and deliver vaccination shots for a really big chunk of our population. But now, because of incompetence, because of science denying, we didn't do that. So we're stuck with like at most almost 12% of people, of the population vaccinated here in Brazil, which is a shame. And we can really for sure say that it could be avoided, because we saw in the past what can be done.
Yeah, I think it's worth looking at this graphic as we kind of pivot from the COVID reality to the vaccine situation in each of these countries. So it's 42% in the US, which, you know, I think, again, coming from the perspective where we're trying to get people to their vaccine shots, we keep feeling like it's not enough, because we, you know, Epicenter just did a tabling out in Jackson Heights, and you know, one of the volunteers said, I went to about 10 stores, 70% of the retail workers were not vaccinated. And so I keep thinking, oh, we're so behind. And then I look at this. So you were saying, Valerie, that if you had stayed in Peru and not come to Miami today, you think it would have been December before someone in your age group would have been vaccinated?
Yes, for the plan, the country plan, we are gonna vaccinate for July, for August, just to people from 60 years and up. No, that's all that they are gonna try. But at the same thing, we have a political problem that we have this election, so we don't know really who's gonna enter as a president in our country. And now we have like two candidates that are really the extremes, right and left. And they maybe the right extreme will work in the same line that they are doing now, but we are not sure about the left extreme. And that happened also because we have all this public health system that it's not working, because and also we have a problem with the education. All this year, all the 2020, our kids didn't study all the year, so we just have this big crisis, educational, health crisis, political crisis. So we really don't know what we're gonna happen, what we're gonna have, and what it's gonna happen. So until the 28th of July the 28th, we're gonna have this vaccine for people from 60 to above, no? But para arriba. But then we're not sure what we're gonna have. And really, for us that we have 40, and my boyfriend here have 50, 55, we really don't know when it's gonna come. So this was the solution for the moment, because we want to work and we want to have also a relation with our family, that they are suffering because of the distance thing and the mental thing that comes with COVID. So yeah, it was a solution to come here and try it, no? And it was really fast experience. No, it's supposed as well something to reactivate the economy here in the States. So we understand that they can give us that kind of welcome now, and not just help us in the health way, no?
Yeah, we've been asked which states don't check. It's an interesting proposition, because I think for some states it is kind of part tourism and then part the family members of large immigrant populations. Which vaccine did you get, Valerie? Today,
Sorry,
it's okay. What type of vaccine did you get today?
Pfizer.
Pfizer. Okay, so you'll get the
I have to get the second one. Yeah, I'm going back, and I don't know exactly what day and how, but I should come back.
But you'll come back and get it. Yeah, that's
maybe with my mother if she doesn't get hers. She's 73, but yeah, we're waiting. This week maybe she will get one in Lima, no? Hopefully.
Yeah. The good news is we have hundreds of people watching. I have no questions yet, so please do. If you have any questions, it's rare to have kind of this country-to-country conversation. I'm so grateful for it. So please do put your questions in if you have any. Rohan, I saw you nodding yet again on the political uncertainty of it all. The parallels are quite uncanny. How are elections playing out there, but also how are they affecting on the one hand, both public sentiment towards the parties as well as the logistics of running an election in India is like nothing I've ever seen anywhere else in the world. And the logistics of this response to a COVID surge are like nothing I've ever seen. So just can you paint that picture for us?
I would say there's a bit of a difference from some of the other countries, including what the US was dealing with last year, where the Indian government did not go into the trap of science denialism. There was no anti-vaxxer movement, no anti-masking movements. By and large, I would say, while there was a lot of other complex nationalism, a lot of blaming minorities, blaming the Muslims for spreading the disease, for example, last year, there was no straight up anti-science push from the government. Over December and January, this started to turn into complacency as the numbers really went down in India. In September last year, when we hit our peak, it started going down quite bafflingly without any restrictions. And India proclaimed quite loudly that we had broken the link between new cases and mobility, that you didn't need lockdowns to start bringing cases down, which may have sent the wrong message. We also had elections in one state, Bihar, last year without having a big surge afterwards, which gave the election commission and the politicians confidence that they could hold elections to 4 states and 1 union territory over March and April. And that has turned out horribly because it has been timed exactly as the second wave has gone up. My colleague has written about one of the longest state elections we've ever had in terms of length in West Bengal, just near Assam, which is now having the largest surge in the country in terms of new cases. Elections naturally mean that tens of thousands of people turn up at rallies. You have a lot of movement within cities, and between states. The government also allowed a large Hindu festival to carry on with millions of people showing up on the banks of the Ganga, the Ganges, in March and April. Partly because of this complacency, the belief that enough people had been infected. It was not entirely anti-science, although some of it was triumphalism and maybe denialism. But there was certainly the sense that India has conquered COVID and we can look forward, and that has been shown up as being terribly misguided today.
Yeah. So Rohan, you've alluded to this, that your feeds are filled with people looking for oxygen and hospital beds. Can I ask what toll this is taking on you personally? I mean, do you know dozens of people with COVID, hundreds? Like, how are you even keeping track of that? And then how are you kind of coping with that plus your job?
It's a tough question. I think a lot of journalists, particularly, are going to have a difficult time coming out of this, because a lot of people look to us to find resources, because journalists have access to a little more information. Even if I'm fortunate enough not to have folks in my immediate family currently needing hospitalization, people have reached out asking for help in trying to find things here. I'm inundated with messages and requests from help from close and people further away. And this is true for any journalist in India at the moment, because we are seen as having access to information. It's hard to stop doom scrolling, to looking at all that information because you think you might be able to help that one person. There have been some very heartening citizen initiatives to connect those looking for things with beds that are available, with oxygen that is available, other folks to get donations, to give food and supplies to migrant workers, for example, who are without resources in lockdowns that are now being imposed around the country. So there are efforts from both individuals and in some places governments as well, that we can look at as somewhat hopeful. But it has really been devastating. The last 2 weeks, we thought we had seen the worst of it in 2020, and this is nothing like that. The fear is that these are variants that we don't know whether the vaccines are good enough against them yet, and that they might be reinfecting people who were infected last year, which honestly should be scary, like I said earlier, for any city around the world. It's not necessarily a purely Indian thing. This is something that maybe affect the longer this speaks to the larger question of vaccines. The longer that this pandemic remains, the chances of variants that can escape from vaccines is larger, and truly Delhi, I think, is seeing that today.
Yeah. Valerie, is Lima in any state of lockdown right now? What is it? What is it like? Lockdown meaning, are you able to move about from your home to work to grocery store? It's all open, or?
No, sometimes we have to, we have on Sundays that we can't move at all. And then on Monday to Saturday, we have to get closed. We have to go to our houses at 9 in the night, until 4 a.m. That's, they are doing that. And then we have this Holy Week, Semana Santa, in March, and we got like 4 days without moving at all. Just people that have some permissions or for essential works, but normally we have to stay at home those days, and usually from 9 to 4 a.m. But between March and June last year, we were closed all the time, every day, every business, everything.
People are wearing masks? Masks? Are they wearing?
It's obligatory 2 masks. And if you go 2 masks all the time, and if you go to a market, you have to have a face shield as well.
Okay. So
that's obligatory. Like that's obligatory. That's a way we say, no?
Mandatory.
Sorry.
Okay, no, so
mandatory.
You have it perfect. That's perfect. André, what is the scene like in Brazil in terms of lockdown, mask, people moving about?
Again, I come back to the example and the narrative that comes from the government that doesn't wear masks and goes gathering crowds outside. So many people don't believe this, don't believe it's really necessary when it is. And 2 things that Rohan said that really resonated for me here in Brazil. One is the job of the media, because when you have like an extreme and far-right government, there's always a huge attack on the media, because it's the media that puts power in check. It's the media here that shows that some of the information is pure and simple fake news, and they don't like that. And it got to the point that the actual numbers that you see and you get from Brazil in terms of cases and people vaccinated and the number of deaths come from a consortium of medias that were rival media companies that got together to provide actual true information about the number of cases and deaths here, because the government didn't do a correct verification of that and didn't want to put out those numbers. We had like 3 or 4 ministers of health that were fired in the middle of a pandemic, which is like unprecedented and completely absurd. So number one that I would like to say is that the job of the media, how it was so attacked here in Brazil because of politics, and how it became crucial and vital during this pandemic. And the other one, it's the how long it takes for us to get out of this mess. It takes more time to different variants develop and what is already happening, and we become a threat to the whole world. And Elena said it perfectly when in the start of our conversation here today, when she said that we are all part of a whole. So if even countries that are more advanced in their vaccination process don't think about Brazil and India and Peru, it will come back and bite us, everyone in the behind, because it will be more variants running around and coming to these countries that had vaccinated their population. And we have to think this as a humanitarian effort at this point.
So on that note, I'm going to wrap us up and ask you kind of a round robin. So it'll be quick question, quick answers if you can. And these two questions are related. So it's, what do you want people to know who are watching? What should they know about your country and your situation right now? And related and important, maybe more importantly, how can we help? Right? Is there, Valerie, should we start with you? What do you want people to know about Peru, and how can we help?
We have a abandoned country. We really need people to know that we have to grow de manera estable. We have to
Stable manner.
We can't be just yes, we can't be just a name. We are not just Machu Picchu. We are a country. We are 33 million people. We have to be part of the world, not just the COVAX facility program or the poor country like that. We are part of the same world. No, it's incredible that things, I don't know, work with some countries and others no. We need a lot of help. We need we need to be, I don't know, equal. But I don't know if it's just Peru. It's everywhere.
Yeah.
Everywhere.
Andre?
Yeah, what they have to know. They have to know that we are 33 million people, but we like André say, we have this number of deaths for COVID, around 6,000 people. But then if you count the non-violent deaths in the last year, we have like 150,000 people. So you have a different number. You have a different situation. What they say and what it's going on, and then at the same time we are one of the worst countries in el tratamiento de esta pandemia, ¿no?
Andre, what do you want people to know, and how do you think we can help?
I think we can, and again, I hate to sound like political. I'm not a member of any political party, not affiliated, but it always comes to our government. Like I said, we have a beautiful and really good national public health system that worked again in the past, and this was an example to the whole world. And right now we have one of the worst scenarios in the pandemic. The word genocide has been used a lot here in Brazil from different legal entities while describing the work of our current president while dealing with the pandemic. And I think what I really wanted the world to know is, like, we need international pressure here. We are starting right now to hear about bringing the case to international courts. and really serious organizations and legal representatives here in Brazil talking about that. And because if good actions and good measures are taken, we can have a really better situation here in Brazil. We have the means to do that. It comes to our government being pressured to doing so. So that's what I would ask the world that are hearing us to help us in that way.
Valerie mentioned COVAX, and we reported yesterday that the World Health Organization tomorrow will start a fundraising campaign towards COVAX. It's a program called Go Give One. I believe the website is gogiveone.org. And there's a lot of feelings about COVAX as a controversial program because it's essentially charity. It won't be enough to vaccinate the whole world. It's a fraction of countries' populations. What I wrote is it's possible to donate to COVAX even as you fight for the right of countries to make or access their own vaccines. And it seems like we're in such a state right now that we're going to need multiple levers to pull. So thank you, Valerie, for mentioning COVAX. There is an announcement coming on that tomorrow, which allows individuals to give. And we have to ask the question of, we're in such a sorry state on this that we need individuals to give, to Valerie's point, to care about an entire country. And that's sort of where we're at. So Rohan, I'm going to give you the last word on what do you want people to know and how can we help?
So in terms of how you can help, I'll be selfish and say Scroll has a reporting fund as well as subscription, which would help our journalists get out there, cover more ground, do more of the sort of storytelling. Some of the things that André mentioned in terms of the media, it is becoming, while we haven't had science denialism, we do have attacks on the media here, suppression of data and information. And so we do have a ground reporting fund that people can support. There are a lot of resources, also a lot of crowd-funded citizen actions that I can share links with you guys that you could put out if anyone would like to help in terms of India. To combine the last to what I would like people to know as well as what you can do. I'm seeing on my American friends on my timelines a rather like stark difference about what things are like. People are starting to make plans for the summer to go out to actually meet people again, and which is great. And I don't begrudge Americans doing that, but as I have said before, the pandemic isn't over until it's over for everyone. We have seen here the dangers of complacency and the fact that variants can develop. COVAX and other efforts to vaccinate the rest of the world will not be enough, as you have mentioned. But I don't think a lot of Americans, maybe your audience, knows quite how unequal the global vaccination system is, how difficult it's going to be, how long many countries are going to have to wait until they get sufficient numbers to vaccinate their populations. And even just that awareness, I believe lawmakers in the US have pushed the president, and there have been some talks about opening up the intellectual property rights for vaccinations. Even just awareness of this among the American population, I think, would be useful, because there are things that the US can do, and the US can be influenced by its people.
Thank you, Rohan. That's a really good point. I do think on the media, supporting media right now, because we've seen such a breakdown of information and communications around healthcare, the role that we are playing is unprecedented. I said we were founded as a newsletter. We never intended to help people get their vaccines, but that feels like the most important, urgent need that we play in our community right now. And all of you have really talked quite eloquently about the service that you're providing to the people of your countries. And I applaud you for that. We join you in that. And we will keep trying to get the word out. So I do thank you all for being with us tonight. I know, and morning for you, Rohan. I'm sorry we got you out of bed. And it's not like you've been sleeping a lot over the last few weeks anyway, which we're also grateful for. So thank you to our guests. I also just want to thank our team behind the scenes, Stefan Kaplan, Janelle Zagala, and Nitin Mukul on graphics, Chloe Tai on social media, our partners at Scrollstack, who are going to help get the word out globally as as well. We're so grateful for their partnership on this live stream. But mostly, I thank all of you for joining us and for taking interest in this really important issue. We will see you next week for the latest on vaccines and COVID. Till then, please sign up for our newsletter, epicenter-nyc.com. It has all the information. You should follow Scrollstack too. I'll give them a shout out. You should follow the organizations of our folks. I believe their Twitter handles and ways to follow them are in the post with this live stream. Until then, we'll see you soon. Please stay safe, everybody. Thank you so much.
Thank you.